When you have blepharitis and meibomian gland dysfunction, it's critical to clean your lid margins and reduce the amount of Demodex mites, bacterial overpopulation, and dead skin cells that might be present on your eyelids, contributing to reduced oil secretion and ultimately dry eye. Today we're talking about a product called Cliradex that can be used on the eyelids, lashes, and face to achieve optimal ocular comfort. Welcome to Eye School with Dr. D, where my goal is to arm you with the knowledge you need to take control of your eye health and have the best vision possible. Like and subscribe for videos every week. You've made it to Eye School with me, Dr. D. I've recently partnered with BioTissue, the makers of Cliradex, which is a cleaning solution for blepharitis and Demodex that we'll be discussing today. I'm so excited to share more information about this option, as I know many of you have asked my opinions on the wipes and cleansers before. Before we get started, if today's information is helpful to you, I would encourage you to check out my dry eye playlist, which I will leave right here. I've talked on this channel before about the impact of Demodex mite overpopulation, bacterial biofilms, and their impact on the very important Meibomian glands of the eyelids. I'll leave links to my videos about Demodex and Meibomian gland dysfunction in the description below, as well as up here.
Pause it.
Okay. I like when you scared me. I was like,
well, I can keep that one too. Did you not remember I was behind?
I mean, I thought you were over there. You said you were checking my hair light or something.
I had to get myself over there without you being suspicious.
There are many approaches to altering and improving the Meibomian glands. I've talked a lot about new light therapies like intense pulse light and photobiomodulation on this channel. And you know that I'm also actively clearing gland obstruction with heat plus expression therapies like tear care. One of the mainstays of treatment that I feel will never change is the need for great at-home care in between the advanced therapies your dry eye doctor is performing in their clinic. Forming habits around your lid care will make a huge difference in how your eyes feel from day to day. I've seen firsthand that my patients who are diligent about their at-home care, like warm compresses, lid hygiene, diet, and supplements, have better outcomes than those who are not as compliant with their at-home routines. Ocular irritation, inflammation, and lid margin disease are all associated with poor eyelid hygiene, so it's especially important to include lid cleansing as part of your routine. Cliradex is a natural, preservative-free lid, lash, and face cleanser formulated with 4-terpineol. Now, I know I've talked about tea tree oil and its potential harm to the Meibomian glands in the past, so let's cover 4-terpineol today and why we might consider using it, even in light of the 2020 study that showed tea tree oil can damage the epithelial cells of the Meibomian glands. So scientific studies have shown that 4-terpineol, or we're going to call it T4O from now on, is the most important ingredient found in tea tree oil, with even greater miticidal effects than tea tree oil itself. When I say miticidal, I mean ability to kill eyelid mites like Demodex or Demodex. This is because some of the tea tree oil's ingredients are antagonistic, meaning the efficacy of one component is canceled out by the presence of another component. So just using straight tea tree oil is not necessarily the best thing. The idea is that using this T4O is the most abundant ingredient in tea tree oil, but it's more potent than tea tree oil at equivalent concentrations, and its actual killing effect on Demodex mites was even more observable at a mere concentration of 1%. So what Cliradex is doing is taking that T4O out of tea tree oil and using that particular component because it's the one that's effective anyway. The problem with not eliciting T4O is that allergic reactions are observed when tea tree oil was used as in a topical formulation. In addition, some of tea tree oil's ingredients neutralize each other, and that renders it ineffective. Ocular irritation is a chronic problem for patients who seek relief from Demodex mites. Patients are often frustrated and looking for a long-term solution. And the key is realizing that long-term solutions usually mean a change in daily hygiene habits. We've got to get patients using, daily lid cleansing. Ocular hygiene is important to maintain a clean and healthy ocular surface environment and tear film. Long-term neglect of the lids can have implications related to blepharitis, making dry eye worse, and having more severe ocular surface disease. There was a recent study by Dr. Al Cabot showing that Cliradex with 4-TO on average kills organisms in less than half the time it takes for hypochlorous acid to have an effect. Hypochlorous acid, of course, is what we've talked about in the past that's present in some of the We Love Eyes formulations and Avenova. And that hypochlorous acid performs nearly the same as mineral oil when compared to T4O. Cliradex is available in two forms. So we have a light foaming cleaner as well as Cliradex Towelettes for severe ocular irritation. So I've been very open and honest in the past about tea tree oil and its derivatives and how they can be damaging to Meibomian glands per that 2020 Harvard study. Personally, I feel that tea tree oil and I've talked about before, green tea falls into this area, as well as bakuchiol, as well as lavender. A purified natural form of tea tree oil like is present in Cliradex can be very useful in managing bacterial biofilms and Demodex infestations to reduce the symptoms of blepharitis in my patients. We do have to be mindful and be careful of how we use and how long we use these products, but at this point, I have not stopped recommending tea tree oil. I think that it's still a very useful ingredient that we can use in our patients. So just comparing, the wipes are quite strong, and so my opinion is that these should be used initially at diagnosis to quickly eradicate bacterial microorganisms and reduce Demodex overpopulation. I like to use light therapies like photobiomodulation and IPL in conjunction with the traditional Cliradex lid scrub approach. Specifically, if your issue is with Demodex, IPL is very effective at killing Demodex. I've got the wipes open right here. They're quite strong. It's a very concentrated little wipe, and it is on the smaller side. And to me, these are very much used at the beginning of diagnosis when there is an overinfestation, when there's an overpopulation of Demodex. That's when we're wanting to use this stronger Cliradex wipe. This might even be something that we use in clinic and your doctor actually directs the treatment. Cliradex Light is your at-home daily option to cleanse not only around the eyes, but really the face, because if we reduce the amount of Demodex on the face, we can hopefully prevent the overpopulation on the eyelid margin. So once Demodex and bacterial populations are controlled, then we maintain by switching over to a foaming cleanser, mostly applied to the face and not directly over those Meibomian glands. Advanced or severe blepharitis occurs with an overpopulation of bacteria and Demodex. The homeostasis or balance of your skin is disrupted, so you don't have to aggressively treat with 4-TO forever, just initially to eradicate those populations and then later as a maintenance. There will be times when you may have an inflammatory flare and the towelettes can be used again. So this is how I am truly using 4-Terpineol in my practice. I do like the science behind Cliradex in particular and have had success with it in my patients. If you've used Cliradex, I would invite you to share your experience with the iSchool community down below. I love to hear how you guys are using dry eye therapies, what's worked for you, what hasn't worked for you. So please share your experience with Cliradex Towelettes as well as Cliradex Light down below. That's going to be it for today's lesson. Class is dismissed. I will see you next time.